Hey guys, Dr. Megan Faulkner here with Apex Sports Medicine, and in this video I'm going to show you how I like to use the T-Tool two different ways to work through the rectus femoris muscle tissue. So I like to have my patient supine here with the lower leg hanging off of the table. If this is uncomfortable for your patient's low back, you can always have them bring the knee up, bend it, plant the foot on the ground, and that helps keep the lumbar spine a little bit more neutral. So in this position, the rectus femoris crosses over the front of the hip joint, and it also crosses over our knee joint. So here we've pretty much locked out the hip with the table in the way. So we're going to actually play with the extension and flexion of the lower leg or the knee in order to get glide of that rectus femoris muscle tissue. So I'm going to hold the T-Tool by the rounded edge, and I'm going to use this nice wide edge. That way, if there is any tension on that tissue, because it's so thin, I can make sure and grab all of the tissue and I won't fall off either side or either edge of that tissue. So I'm going to do a nice scan here to see what the quality of the tissue feels like. And if I feel any bumps, knots, increased tissue density, then I know I probably need to work in that area. So what I can do is the first way is I can just use massage strokes here over the knotted tissue. The T-Tool has such nice weight that I can let it do most of the work, but I can also back up with my hand here and apply any extra pressure that I might need. And again, just use some kind of almost massage strokes here. The second way we can do this is if you find that tissue has a knot in it, we can do some pin and stretch. And here what we'll do is find a part of the tissue that has a knot in it, and we may pause here. We're going to extend the knee, which shortens that rectus femoris muscle tissue. I'm going to hold that knot down using the T-Tool and using an inferior to superior tissue pull. And then the patient's going to let the heel fall down to the ground. We're flexing that knee and we're extending that rectus femoris tissue, providing a little bit of a stretch right under that T-Tool, holding for a few seconds, and then we'll release and we'll find another spot. So we'll find a knotted piece of the tissue. We'll have him straighten that knee, apply a little bit more pressure, and then have him flex that knee to stretch that rectus femoris tissue, hold for a second or two, and then release. So that's the two ways that I like to use the T-Tool to work through the rectus femoris muscle tissue.